the Energy and Commerce Chair, Brett Guthrie, says these aren't cuts. This is the slowing of Medicaid because it's going to cost more than $1 trillion a year in the next decade if lawmakers don't rein it in.
Yeah, you mentioned work requirements. They're calling it something else. They're calling it community engagement requirements. And what that essentially means is that able-bodied adults who receive Medicaid would need to, under this new plan, prove that they are contributing in some way, whether that is through work, which would be working 80 hours per month, demonstrating that they're taking education courses or going through work programs, as well as community service. They could be giving 80 hours of community service per month as well. And so they're sort of broadening out this idea of work requirements to something called community engagement requirements. But that's going to be a significant change. That definitely jumped out at me.
When it comes to adding work requirements to Medicaid, this is not just something that is listed in Project 2025. This is actually something that states and the Trump administration allowed in his first term. To say that adding work requirements to Medicaid is not part of Trump's agenda it's a little bit silly because he actually did it already. Some of the work requirements were struck down actually by the court system, and some were kind of stopped by the Biden administration. Now, not only are work requirements a part of the Project 2025 proposal, it's also a part of many other conservative think tank proposals. And this is something that has been out there since Obamacare came to be back in 2014. If you listen to what conservative and Republican politicians often say, they often talk about work requirements. If you have been paying any attention at all to Medicaid for the last 5, 6, 7 years, you would know that work requirements are a huge deal. This is something they have been talking about. This is something they've been trying to do. Many states have tried to enact this and have been struck down once again by the courts or by the Biden administration. Many people, Republican, conservative, liberal, Democrat, whatever, many people got stuck on the Project 2025 portion of that last video instead of hearing some of the other things that were said. There are many policies, especially related to Medicaid, that Trump actually already did. Project 2025, along with many other conservative think tanks, just recommend for Trump to simply restart and or expand those things that he already did the first time. So if you were a betting person, you would bet that he's going to do it. He already did it. A simple Google search, if you look up Medicaid work requirements and if you look it up under the Trump administration, you will see that, again, I'm sure Fox would have articles saying that this is something that Trump is likely to implement. Like, this is pretty much a sure thing, again, because he did it the first time.
House Republicans unveiled their one big beautiful bill, the details of Trump's tax plans. Let me break it down. Extension of the Tax Cuts and Jobs Act. The one big beautiful bill would extend the Trump-era Tax Cuts and Jobs Act, which took effect in January 2018. The TCJA lowered tax rates for individuals and corporations. Individual tax cuts are currently set to expire at the end of 2025, while corporate cuts remain until 2028. Research from the Penn Wharton budget model from the University of Pennsylvania found that the TCJA increased the federal debt. The new bill is projected to add another $4 trillion to the national debt. The Center for American Progress noted that the 2018 tax changes disproportionately benefited high-income households. The Tax Policy Center found that, in 2025, just before key provisions expire, wealthier households would receive the largest benefits. According to the Ways and Means Committee, the new bill would make the 2017 cuts permanent to prevent an estimated 22% tax hike on average taxpayers. No tax on tips. During his campaign, Trump promised no taxes on tips. The bill doesn't eliminate these taxes outright, but offers deductions under specific conditions. Workers earning under $150,000 annually in traditionally tipped jobs, servers, stylists, nail techs, etc., may qualify. The tip must be given voluntarily, for example, not added automatically to the bill, and the worker cannot be in a high-income profession like law or accounting. No tax on overtime. Similarly, no tax on overtime was a major talking point of Trump. Like no tax on tips, workers earning under $150,000 may deduct overtime pay if it meets standard overtime rules and is not classified as tips or bonuses. Deductions for car loans. The bill also includes a car loan deduction of up to $10,000 per year, available to individuals using a personal or new U.S. assembled vehicle. That's to Medicaid. The bill includes about $4.5 trillion in tax breaks. To offset costs, it proposes cutting Medicaid by $880 billion, which amounts to nearly the program's entire $839 billion budget in 2023, according to the Congressional Budget Office. On May 11th, Representative Alexandria Ocasio-Cortez responded on a live that is now posted to YouTube.
The number one priority for Republicans this year is to pass this massive tax cut for the rich and to attack and gut Medicaid in order to pay for it.
Republican Speaker Mike Johnson countered, "Our one big, beautiful bill will deliver the America First agenda. This has been a year in the making, and we won't rest until it's done for the American people." Not all Republicans agree. Senator Mike Lee responded to supporters, saying the bill wasn't perfect. "We shouldn't let perfect be the enemy of good, but we also shouldn't let the easy be the enemy of the necessary. A bill that adds $20 trillion in debt over 10 years is not just not perfect." What do you think about the big, beautiful bill? Let us know in the comments.
What we're actually considering to make it legal to take away health care for kids and for seniors. That is so outrageous. And why is it? It's not because my Republican colleagues don't want their folks that they represent to have access to health care. They're intimidated by Trump. This is totally outrageous that we even have to have a discussion about taking away health care. Not to mention all the consequences, the insecurity, the suffering. And then in rural America, where we depend on those hospitals, they won't be able to operate when we take away Medicaid. They won't be able to operate. You know what will happen? They'll work hard, and that'll be in red states and blue states. And they'll keep providing services, even when it's free, until they can't anymore. And it's an absolute disgrace that this Congress is even having a discussion about taking away health care from children, from seniors, from disabled people.
Officially cutting health care. They're cutting health care for roughly 20% of Connecticut's 2nd District because they're cutting Medicare and Medicaid benefits, and they're using some kind of system to disguise it. The Republican Party has introduced a bill to cut Medicare and Medicaid from millions of Americans. To be specific, around 83,000 Americans inside Connecticut's 2nd District use Medicare and Medicaid. And the Republican Party, under the guise of fiscal responsibility, is cutting that benefit. Now, the truth is they're saying it's meant for only truly disabled people, meaning they're going to determine what your disability is and whether your disability qualifies. And they're also making sure that you go back to work. And if you are disabled and can't work, too bad. You're not going to get the Medicare or Medicaid that you deserve, the one that you've paid into, the one that all Americans pay into to make sure you're taken care of. There's so much healthcare issues in this country. The last thing we need to do is touch a healthcare system that helps Americans. My name is Kyle Gauck, and I'm running for Congress in the 2nd District of Connecticut for the United States House of Reps. If you like what I've got going on and you're not following along, you're doing it wrong, please check out the link in the bio. Sign up for the newsletter every Tuesday and Thursday. Check out my website, kylegauck.com. And if you have it, it's a grassroots campaign, no AI PAC money, no corporate money. Please feel free to donate. There's a link in the bio for that too. And if you made it this far, as always, thank you. I love you, and we will definitely talk soon.
We have the Medicaid cuts. Very late last night, the Energy and Commerce Committee released their proposed cuts for the budget reconciliation, and here's what's in it. An 80-hour per month work requirement for any able-bodied adult without dependents. An increase in eligibility verification from once a year to twice a year. A 5% boost in federal funding that happened during COVID would be removed. Immigrants would be required to show proof of citizenship to receive Medicaid. States that provide it without the proof of citizenship will lose federal funding. The provider tax that some states use to pay for big portions of their Medicaid programs would be removed. A preliminary report from the Congressional Budget Office has estimated that over 8 million people will lose health care because of these cuts. Those would mostly be children in poverty and senior citizens. There would be large impacts on hospitals' ability to stay open and also nursing homes, just as the boomers are going into them. And just as a reminder, this is all to pay for tax giveaways to Mark Zuckerberg and Elon Musk. These proposals will get rolled up into the other committees' proposals for budget reconciliation. The House will need to vote on the whole package, and then so will the Senate. This is not subject to the filibuster, so it will be simple majority up and down both chambers. Call your reps. especially if you have Republican representatives in the House of Representatives, because there are many moderate Republicans who are already in danger for the midterms and they know it, and they have publicly stated they won't vote for Medicaid cuts. They're starting to try to spin these cuts as waste, fraud, and abuse, not cuts, but they are 100% cuts.
I keep getting asked if I have any regrets voting for Trump. None yet. How's it feel to win? Great. Really? It's not going to happen.
The plan to defund Medicaid and everything else is still going to fall on conservative deaf ears, even in rural areas like where I live. The oligarchs that are sitting up there in power have somehow convinced the rural conservative places of our country that it's other people, right, that are the problem. It's the immigrants. There's this delusional conservative exceptionalism where people who receive government assistance here in Appalachia genuinely believe they deserve them more than anyone else does. They're the exception to the rule. They're not abusing the system. They deserve this. It's delusional. It's delusional and it's selfish. Immigrants don't use Medicaid, guys. But you know who does? Really old people who live in assisted living, because Medicare and other insurance companies do not cover long-term assisted living. Children who need annual well visits. People who have lost their job and need health care coverage in this horrible job market while they're in between jobs. Because privatized insurance costs hundreds and hundreds of dollars a month. There could be a million reasons why people are on Medicaid, food stamps, whatever the reason is. And I wonder at what point any sort of conservative will sit back and realize that it's finally affecting them and that they somehow can't blame this on another people group. They can only blame themselves.
We've done assessments because if you live in a rural community, you're going to be hurt too. In New York 23, 25% of people are on Medicaid in this area of upstate New York. Westfield Memorial Hospital will be at risk of closure. UPMC Chautauqua is at risk of closure. Schuyler Hospital at risk of closure. California 23, where 46% of people are on Medicaid. Redlands Community Hospital at risk of closure if this passes. Victor Valley Global Medical Center, Loma Linda University Medical Center, all at risk of closure. Colorado 8, 24% of people in this community are on Medicaid, and Platte Valley Medical Center will be at risk of closure if these cuts pass.
Yes, Trump's voters will be the ones most impacted by cuts to Medicaid. Red states, especially rural area in red states, receive a disproportionate amount of Medicaid funding. Mississippi and West Virginia receive the most federal assistance for Medicaid, and these are the next highest: Kentucky, Alabama, South Carolina, Arkansas, and New Mexico, all of which voted for Trump except for New Mexico. The lowest rates of Medicaid use are all in blue states, with the exception of Wyoming. Red states also have much higher rates of disability, which is usually tied to Medicaid. The biggest concern is probably about the rural hospitals, which mostly get their funding from Medicaid in Republican states. Those hospitals will close. And that is why some of the more moderate Republicans are opposed to Medicaid cuts, including Josh Hawley, who wrote an op-ed in the New York Times today about how these planned cuts to Medicaid are both immoral and political. Missouri has a lot of people on Medicaid. A lot of the red states, especially the ones in the South and in Appalachia, are subsidized by federal funding from blue states, and they're about to lose a lot of it.
The mental gymnastics that the Republican Party has to do in order to justify their ridiculous policies is just mind-numbing. I'm sure by now you saw AOC's takedown of that Republican where she says, "I'm not going to yield to disrespectful men." But did you see what that exchange was about? It was about the Republican Party not outlining miscarriage as an exemption to the work requirements in order to maintain Medicaid. Meaning that if a woman miscarries and it is a traumatic miscarriage, she would not be exempt from work requirements and she would be eligible to lose her insurance.
So if a woman miscarries, she would then be kicked off the exemption, correct?
The exemption also includes postpartum coverage.
Postpartum, miscarriage. Is miscarriage covered under that?
If a state includes miscarriage under postpartum coverage, then yes.
Federally, in this statute, is miscarriage explicitly included in the language of the text?
The bill includes postpartum coverage as an exemption.
Miscarriage is not listed, correct?
If a miscarriage by a state is included in postpartum coverage, then yes.
Is miscarriage explicitly included in the text of the bill?
It is not explicitly stated in the text.
There are 13.7 million Americans on the other side of that screen right there. Hello? Hello. I'm talking to you because I work for you. And they deserve to see what is happening here. Because there are plenty of districts, including Republican ones, where 25% of your constituents are on Medicaid. 40% of your constituents are on Medicaid. And yes, I am talking.
Will the gentlelady yield?
I am talking to them, and I will not yield because it was a terribly disrespectful comment, and I will not yield to disrespectful men. In terms of some of the exemptions, pregnancy is covered, correct?
May I interrupt? I'm glad you're addressing us instead of speaking to the camera.
Yeah.
Keep going.
Pregnancy is covered, correct? Yes. As an exemption? I have a question. Given the Dobbs decision and the fact that many women in many states are forced to be carrying.
I'm gonna have to stop. I'm gonna reclaim my.
Okay.
my
What about
reclaiming my
miscarriage?
time. Thank you.
What about miscarriage?
I'm reclaiming my time. Thank you. I just want to make the point that we'd like for you to address the Republicans and let's have a dialogue this way and not to a camera. Mr. Chairman, I yield back.
But
The gentleman yields back.
But I'm asking the question. What about a miscarriage?
The gentleman
I'm
yields
trying to
back.
engage in the way that the gentleman.
The lady
requested
is
me
out
to.
of order. The gentleman yields back.
Oh, so we don't want
Chair,
to answer
is
for
there
women having
someone on the
miscarriages and
Democratic
bleeding out in
side
parking
who
lots.
looks
Okay.
to be recognized?
Huge amounts of your state budget comes from Medicaid, because the way Medicaid works is that Medicaid is the way Medicaid gets dispersed is actually by the states. And so Medicaid is paid for by a combination of state and federal match money. In wealthier states, the federal match is lower. So, for example, in New York, the match is 1-to-1. For every $1 that New York spends, the federal government spends $1. Other states, like Kentucky, they actually get a higher federal match, where 70% of their around 70% of their Medicaid disbursements are paid by the federal government, and 30% are paid by the state. And so what that means is that for so many state budgets, a huge amount of the money that comes in for the state budget in general comes in through Medicaid financing. And so if you touch Medicaid, you are also blowing a massive hole in a lot of state budgets, which are going to affect schools, which are going to affect lots of other things to make up the difference. And so I have some numbers here that I want to tell you about because I have pulled up some of the Medicaid. So for example, in Pennsylvania, 40% of the Pennsylvania state budget is comprised of the state and federal match for Medicaid. 40%. In Nevada, 32% of the entire Nevada state budget is tied to Medicaid. In Colorado, Gabe Evans's district, 36% of the entire Colorado state budget is composed of the Medicaid state and federal match. This is one of the reasons why they are going after Medicaid. Because if you go after Medicaid, you start an entire domino effect on state budgets. And so what they're trying to do is gut a lot of the federal matching and the federal finance, and then they're going to gut state budgets down the board. And, you know, this isn't just blue states. North Carolina, 31% of that state budget is Medicaid. This is going to affect red states, it's going to affect blue states, it's going to affect everybody. And they are tricking people into thinking that they can support this whole waste, fraud, and abuse narrative, but the numbers do not add up. In fact, I've been sitting through all these committee hearings. The highest number
that the Republican Party has advanced forward in terms of what can be attributed to quote unquote waste, fraud, and abuse. And mind you, not a single investigation has been put in front of the Energy and Commerce Committee to back these numbers up. But the highest number they have is $50 billion. Even if you believe everything that they say with no evidence, if they've identified $50 billion in waste, fraud, and abuse, why are they cutting $880 billion, nearly $1 trillion? The math is not mathing. And the reason for it is because they have been assigned to find $880 billion because they are going to give $880 billion to billionaires. 2 billionaires.
We're going to win so much, you may even get tired of winning. And you'll say, please, please, it's too much winning. We can't take it anymore.